Today's about PTSD treatment. The disclaimer is there are so many ways to treat. I will not ascribe to one right way and one wrong way. The treatments that I will present today are the most well-known. You guys don't need to go necessarily into the weeds. I'm going to give you a really brief overview. You are more than welcome, if you feel comfortable, to discuss your own personal stuff. It is not a requirement. You do not have to. I'm specifically telling you it's not recommended, but if you feel so inclined to share, you're more than welcome. The way I'm going to present this is not necessarily the way every other mental health professional on the planet would present this information. This is going to be reduced so that you guys can do your best to understand the material. Make sense? Goals for the day: to understand that there are multiple forms of treatment for PTSD. Realize that not all the treatments work the same for every client. Again, like we discussed last week, it's the individual. You really aren't necessarily treating the diagnosis, you're treating the individual with the diagnosis. Person-centered care is going to be really important. It's going to be important for you guys just as much because by the time you're going to get a client, the dog's going to be done. Placing the dog with that client is about you engaging with that client. And every client is different. Learn how to utilize dogs in a therapeutic manner. We're only going to get into the weeds a little bit, but we will get into the weeds. And differentiate between good practice and ineffective practice. And the ineffective practice is simple to identify because it doesn't work. You don't see any symptom reduction. First one is called cognitive behavioral therapy. For those of you that ever decide to join Pause for Purple Hearts, you will hear people say, oh, we use CBT, cognitive behavioral therapy. This one takes a look at thought patterns. Thought patterns generally result in behaviors, and then there are results from those behaviors. So what I've got on the screen is what we call the cognitive process. And yes, I will send out the slides. You do not have to copy all of this down. Reiterate one more time. You're better off listening to me and then accepting the slides later than you are typing everything out. So the cognitive process is relatively simple. I'm going to go through it really slowly that way, because I want everybody to wrap their head around it. It's going to be very important. An event is something that happens. You being in this class is an event. The air conditioners being on is an event. Anything that is an event. Stomping on the floor can be an event. An event leads to what we call an automatic thought. An automatic thought is your brain's knee-jerk reaction to the event. The automatic thought creates a feeling, an emotion. That emotion, if it's distressing, your body and your mind are going to want to react, to relieve the emotional distress. That action you take to relieve the distress has a result. So I'm going to break it down to something that everybody can understand. You're driving along the 12 and somebody cuts you off. Somebody cutting you off is the event. The automatic thought in your mind could be a lot of different things. It might be, this person thinks I'm stupid. This person who's now in front of me thinks I am less than they are. That is a very common thought when you get cut off. That thought elicits a feeling. The feeling of I am less than. That feeling, you want to get rid of it. It feels bad. I know I'm just as good as this Nissan Maxima. That's not fair. What's going on, Nissan? Now you're going to get into an attempt to relieve your emotional distress through action. It could be voting them number one. It could be laying on your horn. It could be saying, you know what? I've had enough, and running straight into the back of them. Those are your actions to help relieve your feelings. The result could be vehicular assault. It could be vehicular manslaughter, depending on how hard you hit them and what happened to their car after you hit them. There are a lot of results that come from that action. Now, would anybody think that that is a healthy cognitive process? Anybody ever had that specific cognitive process by being cut off on the freeway before? So you don't want to admit it? Not that one specifically.
Mine gets a little angrier.
Yours gets a little more angry?
Do tell.
Right? So the key is that cognitive process isn't healthy. So we have to change that process to something that's less reactive for the individual. Now, the event's going to happen. Again, events happen constantly. So in that same event, if the thought process of, oh, this person's telling me that they're an asshole. Okay, good to know, asshole. All right. What's the feeling associated with that person wants me to know that they're an asshole?
Irritation.
Might it be ambivalence? Meh. Might it be, wow, good to know. I'm really glad to know that the person in front of me behaves this way. If the feeling is not distressing, the action therein does not have to relieve distress. But the action might be, for ambivalence, I'm going to give this person a lot of space so they can ruin their own life. It might be, the action being, turn up the music. The action might be nothing. It doesn't create distress. But now you're not voting them number one. You're not running them off the road. You're not laying on your horn and causing a hostile driving environment. Which one sounds healthier? Number two. So, go ahead.
I don't know. I was always brought up to not yell in the car because the other driver can't hear you. Only people in your car. I was taught not to, express horn and all that. But I've heard studies were done that people that are cussing and swearing and yelling at the top of their lungs at the other driver actually don't get ulcers as much as people that keep it in and don't do anything and don't go on their road.
The yelling and the screaming and the flipping them off and shaking the steering wheel, what are those? In this process, what are those?
Releasing your attention.
Right, where is it in the cognitive process?
Action.
It's an action. And it's meant, the purpose of an action is to relieve a feeling. So if the person feels better after swearing and hitting the steering wheel and just getting all huffy, they're looking to relieve the feeling. Granted, they probably stressed out every single person in the car, and in my case, the dog. But is the result of those actions charges? No. Is it somebody dying? No. Is it a healthier way than to run them off the road? Yeah, that's healthier.
I thought so, but apparently it is.
It's healthier, but it's still not great. Because the key is we would prefer to just relax when those negative events come our way instead of the need to react that way. Does that make sense? So the takeaway from cognitive behavioral therapy is that if everyone were to think before they act, and the feelings that they were attempting to relieve were positive instead of negative, they might have a change in their reality. Cognitive behavioral therapy. I'm going to get into this. This is a little into the weeds. A schema is a filter from which we view ourselves, others, and the world. So I want to go back to that same example. If I believe, because I am 5'7" and all of 165 pounds, that everybody thinks I'm a chump, then actions will go through that filter, and all I'm going to think is people think I'm a chump. That's a schema. It's a lens through which we view things. And you can have lots of them. It's never just one. You have lots of them. So the distortion of a filter within the cognitive process can get so complex that it can turn a compliment into a criticism. You ever have a disagreement, or I'm sorry, not a disagreement, a miscommunication with a friend where they were trying to tell you something good and you accidentally interpret it as something negative? There's something there to look at. Why was it your first thought that they were criticizing and not being nice? They're your friend. It's not on your friend, that one's on you. I'm guilty of this. This, by the way, is not necessarily diagnostically relevant. This is just the human condition. The next one is prolonged exposure therapy. This is kind of controversial. There are a lot of veterans that really hate this therapy. There are a lot of veterans that view this therapy as curative. And that is going to be the same thing. Those opinions are going to be the same for every single one of these treatments. Prolonged exposure therapy, the goal is to help the client face traumatic memories and situations associated with them. So, it's about process. The therapist's first job is going to teach coping skills such as breathing, grounding, guided imagery. They're going to gather information about the traumatic event and the triggers of that traumatic event, starting with the least traumatic event in a history and gradually working towards the worst. That's as you get better in the practice of prolonged exposure therapy, you take on more and more severe traumatic experiences. Usually as a set number of sessions, I think it's 12 right now is the going rate. And the symptoms are measured against the baseline, which you take at the very first session. The next one is EMDR, eye movement desensitization and reprocessing. This utilizes the concept of processing a traumatic event while focusing on a lateral moving light or other tactile stimuli that allows the body and mind to focus on the here and now while processing the past traumatic experience. Wow, that was a really long run-on sentence, wasn't it? Yeah. So, think about it like this. Everybody look here for a second. Okay, I want you to think about a bouncing light that you have to keep track of, probably across a 2-foot span. And while you're doing that, you're going to describe the traumatic events that have plagued you with symptoms. The idea here is as your brain tracks that light, it can't dissociate into a traumatic event. The idea here is we want the mind to stay in the room with us, present, and focused on the light while we stir up all of those memories. Post-traumatic stress, you can think of like an office. The brain is the office. Post-traumatic stress is like papers, memory papers all over the place outside of a file cabinet. You open the door, a gust of wind comes in, stirs up all the memories. All of a sudden you become symptomatic. In the case of EMDR, they're stirring up all those same memories, but metaphorically, the therapist wants to grab those papers and put them in the filing cabinet in space and time where they belong. I won't get into the neurobiology of it because y'all be falling asleep, but that's the idea. If you can think of the symptoms and events as paper, when a gust of wind comes through, it stirs everything up. We want those papers back in an appropriate filing cabinet where they belong in space and time.
So the person is focusing on this light while somebody is talking to them about what their triggers are and what has happened and the notes they've
Well, the
taken.
person is talking about their traumatic experience.
person
The client
watching.
themselves. The client is watching and talking about their experience as they watch, prompted by the therapist. Yes?
Would petting a dog be considered another tactile stimuli?
Not yet, but you're ahead of you're ahead of the time. Could it be? Absolutely. Does a dog bring you to the here and now? Mm-hmm. Is it a tactile expression? Mm-hmm. Petting, dog massage. I like to use dog massage for that. The tactile, so when I say tactile stimuli, there's a thing called a tapper that they use for EMDR. Mm-hmm. They look like small little eggs. They sit in your hands and they tap randomly in your hands. They're electric. They just tap. It's not shocking you or anything, it's just tapping. And they can be rhythmic, they can be random, and they can vary on intensity. So the question then becomes is, how much intensity do you need to stay in the room? Make sense? Mindfulness and meditation. I love mindfulness and meditation. I love it for PTSD, I love it for anxiety, I love it for depression. I like mindfulness, frankly, for everything. I like mindfulness for just living. This is about moment-to-moment, non-judgmental awareness. If everybody in the room could just take one big deep breath in, the fact that you focused on that one breath is mindfulness. How many people in the room have iWatches? 1, 2, 3, 4, 5, 6, okay. You guys have that breathe thing on your watch?
Yeah.
You ever use it?
I literally just got the reminder.
You just got the reminder? So taking that 60 seconds and just breathing is mindfulness. It's about being focused on one thing in the present moment, and it doesn't matter what it is. It could be internal or external. We could focus on the sound of traffic passing by. We could focus, God help us all, on the sound of dogs barking outside the room. Granted, I would never meditate that way, but different strokes, different folks. So meditation, once you get versed in it, is about allowing the body and the mind to relax. And allowing the body and mind to relax, it basically slows everything down. Stimulation from a startle response can be an adrenaline dump into your body. Deep breaths, mindfulness meditation would be doing the exact opposite. You're asking your body to come out of an aroused mode and to just be present in the body. Let's talk about medications for PTSD. There are far too many to list. There are uppers, there are downers, there are sideways medications. You are on label, you are off label. You have everything from no box to black box, which a side effect of black box medications is death. You run the gamut. They're used to treat a lot of different symptoms, but not really the underlying cause. That's what therapy is for. The common symptoms: depression, anxiety, phobia, mood swings, nightmares, sleepwalking, insomnia, hypersomnia, adrenaline imbalance. The list goes on and on. There they all are. Just so everybody knows, as the disclaimer says, I am a medications last type of therapist. Not to say that I don't approve of them. I do approve of them. But for clients that walk into my office, I want to do everything I know how to do first. I want to get them as unaroused and as unsymptomatic as I possibly can. If the symptoms are still distressing, I want them to go see a psychiatrist. I want them to get a medication prescribed. It's just like when I say there's no one way to do these therapies, there's no one way to do medications either, and that's up to a psychiatrist. Specifically, a psychiatrist is somebody who has gone to med school and specializes in mental health, as opposed to a psychologist who is a doctor of mental health and not a medical practitioner. Okay? Did everybody hear that? Okay, so the idea is medications are a stepping stone to making you functional enough to address an issue in mental health. About right? Okay. So the idea is, if symptoms are so bad that you can't focus on therapy and you go to a psychiatrist, they give you a medication that starts to alleviate symptomology, then you have an opportunity to work on it. Then it's up to your mental health provider, your therapist, you, and the psychiatrist to downstep the medication if that's what you wish. The practice of mental health, the practice of psychiatry, the client holds all of the power. You, as if you were the client, you would decide what interventions you do want to do, which ones you aren't willing to do. Let's talk about dogs. Everybody loves dogs, right? Yay, that's what you guys said on the last video I edited. I brought up dogs and everybody said, yay. CBT, cognitive behavioral therapy. How do we put dogs in it? It's up on the screen, so you're all cheating already. But, no, cognitive behavioral therapy, CBT. There is nothing a dog can do about an event. If cars were to get in a wreck outside, there's nothing a dog can do about that. If I were to stomp my foot right now, there's nothing a dog can do about that. If someone were to actually walk through either of these doors, there's nothing a dog can do about that. A door gets slammed, there's nothing a dog can do about events. Events are life. They happen every day, they happen all day. The thought. Can a dog impact thought? Yes, but probably not the way you're thinking. Here's why I say that. I'm sure all of you at this point, coming from this specific university, understand that dogs impact the mental state of a human being through chemicals that are naturally released in the brain by interacting with a well-behaved dog. And they give us an opportunity to reality test against what other people say. A mean person could potentially impact how we feel about ourselves. The dog will never be that mean person, which means when we need to know whether or not we are a good person, we can ask the dog. Make sense? Can they impact thoughts? Absolutely. Just having a dog present can help you manage chemically the way you're thinking. You could go from a very negative outlook on yourself to a very positive outlook on yourself. But being the social worker that I am, you should all think very, very positively of yourselves because you are all worth time. Fair enough? It's the last time you're getting social working from me. All right, so what about feelings? We have events, we have thoughts. Let's say the dogs help chemically, they help our feelings, or I'm sorry, they help our thoughts, and our feelings are less distressing. Right? Makes sense? They've impacted the thought, which means by definition, the feeling is less distressing. What do you think would, utilizing that same example from before, what's more effective? Me screaming at the person in front of me, upsetting Larson behind me, or just letting it go? Am I backing up my battle buddy by just letting it go? Does that might that change a thought feeling in my mind? I don't flip out on him. He's better for it. Last week we discussed that vets don't do anything for themselves, but we will do something for someone else. Ask us to help you move, remember? Okay, same idea. Actions. If the thoughts are impacted and the feelings are impacted, is our response, our action to relieve a negative emotion altered? Absolutely. And if we've gone through all of that, yes, the dog has had an indirect effect on the result, but we're going to get better results because we haven't let automatic negative thoughts affect our feelings, change our actions, resulting in a negative result. Everybody tracking? This one's pretty easy. Dogs in therapy regarding prolonged exposure. When engaging in prolonged exposure can feel like going into battle all over again. Dogs can be a battle buddy on the way. They can help strengthen the effects of prolonged exposure because in the moments where you were experiencing a traumatic event, you didn't have elevated serotonin levels, you didn't have elevated oxytocin levels, you didn't necessarily have the battle buddy there of the dog. Which means you could technically go in to prolonged exposure calmer, more mindful, and more aware of the here and now. And should you get activated in a prolonged exposure therapy session, you can ground out through the dog. The dog is something different. It's a change from a traumatic environment, right? Questions on that one? Dogs in EMDR. Technically, they really can't participate. Unless you could teach the dog to bounce back and forth, I guess. But let's face it, that's more entertaining, and we're not really doing a lot of therapy at that point, right? It's like corgis jumping into a pool. Anybody ever watch that? Yeah. Right? It's funny. Thought reprocessing, the dog can help reduce the severity of triggers or alert a veteran to a triggering pattern prior to becoming distressed, which is great. So let's say you're doing your EMDR and you're watching that light bounce back and forth and the dog is sitting there and the chemical, you start releasing a lot of stress chemicals. The dog comes up, maybe your eyes have stopped tracking and they nudge you. Might you remember to keep tracking after the dog nudges you? Sure. It's a little passive participation, but it's still good. It's still good. Same thing with the tappers. You've got the tappers sitting in your hands, and you've stopped paying attention to the tappers. You're in the process of basically leaving the room mentally. Dog comes up, pushes on your leg. Oh, forgot the tappers. I used to work with a client using a tactile style of EMDR/mindfulness piece where I asked the client, I was a civilian client, to just pet the dog, pet the dog, pet the dog. And when the client would get lost in her head, the dog, feeling her hands stop, would throw her head into the woman's chest. And then she'd remember, oh, I stopped petting, and pet, and pet, and pet, and pet. But it was a way for her to recognize the minute she stopped focus. Dogs in therapy, mindfulness and meditation. I just touched on that a little bit. We want the veteran and the dog to be very, very grounded together. Now, mindfulness is all about the here and now. So we focus on an eye gaze. We focus on touch, on smell, on sight. We focus on anything we can to keep our mind focused and present. They can focus on breath, chest rise. Dogs breathe at twice the rate we do. So count the dog's breath, count your own breath. Fur texture, wire hair pointers versus these wonderful soft labs that you guys all have. Behaviors, colors for dogs that are multicolored. List goes on and on. There's a lot of way to incorporate dogs into this type of therapy. And especially for the student body here, I highly recommend this. Anybody ever wants to see what it's like? Come find me. We'll run a little group. In mindfulness, there's a thing called the monkey mind. It's basically when you stop your focus and your mind just spins. Dogs can alert to that because generally you will stop engaging with the dog when your monkey mind takes over. Dogs as medication. Now, obviously, shy of the dog going and getting a medication bottle, and bringing it to you and saying, here, take your SSRIs. Here, take your anti-anxiety. Here, take your fill in the blank. Dogs, chemically, you guys already know all of this. Cortisol's lowered. Oxytocin's increased, almost doubled. Increase in serotonin and dopamine. Anybody want to know when the only other time in the human experience where oxytocin levels get like this? You already know, don't you? No, I know you already know. Who doesn't know? Who thinks they know?
I'm pretty sure.
Give me one of them, Alexis.
Childbirth.
Childbirth. The experience of childbirth, there is a massive release of oxytocin, especially during the first round of breastfeeding, because that mother and that child are supposed to be bonding. It's our body's natural way of saying, hey, that's your baby. Anybody else want to guess the second one? Anybody else brave enough to guess the second one? Oh. For those of you that are smiling, I know you know. Yeah. Orgasms. Right? Now you're all smiling. Some of you knew. I could tell by the look in your eyes. Some of you knew. But no, those are the two two times naturally occurring in the human condition that you can get those extra big rushes of oxytocin. The feeling of falling in love is an oxytocin release. But let's face it, once we're done falling in love, the relationship is what it is. That's why I like the dogs. I can always go back for another fix. Oh, good. We do have an opportunity to have a good discussion. You guys are here to study dogs. This class is about dogs helping veterans. I now remember why I made this slide presentation so short. I want you guys to have a discussion with me about all of this. Don't worry, that thing is recording too, so it should pick up all of you. We have plenty of time for a good discussion. We have 30 minutes. So, let's talk about first the cognitive process. I am not, by any means, the only person that has unique thoughts on this stuff. And if anything gets too crazy, don't worry, I can edit the tape, but talk to me. Tell me what you think. You can, by all means, disagree with me. I have been wrong before. It was a Tuesday. I remember it well. Just once? Don't tell my wife that. She hates that joke. But talk to me. Talk to each other. What comments?
Talking about the hormone release.
Sure. What do you want to know?
I'm just trying to figure out what we're discussing. Or is it just all the slides, all the therapy?
This is an open discussion time.
Oh, okay.
Go ahead, TA. Can you do meditation before you become symptomatic? Yes. Can it be preventative? Yeah. Why not? Can you do it when you become symptomatic?
Yeah.
Can you do it to relieve symptoms?
If you look that way,
What about after?
you can do it whenever.
You've gone from Bruce Banner to full Hulk mode.
I mean,
If you had enough thought in Hulk mode to meditate, would it be effective? Yes. Is there a wrong way to meditate?
no.
Anybody think there is a wrong way to meditate? Try me.
If your meditation is amping you up, you might want to take it down a notch.
If your meditation is amping you up, you might want to reconsider the method of meditation you're using. Unless the point is to get you amped. A lot of sports players utilize a mindfulness meditation technique before they get on a playing field, specifically to escalate their bodies. Does it work for you? Is it good practice? Absolutely. No. Does it work for you? See, those two should always be the same. Does it work? Yes. Is it good practice? Yes. Anybody else want to share? All right, so that's mindfulness and meditation. Let's talk about, I don't want to ask if anybody's had any experience with prolonged exposure therapy. Let's talk about the description of prolonged exposure therapy. Why might the veterans hate it? It forces them to relive. Absolutely. Why else?
Because you pin them down and you poke them until they speak.
Yeah. And it can feel that way.
They can't dodge and avoid the question and they have to open up.
I've actually had veterans come into my office, sit down, and say, if you're going to do prolonged exposure, tell me now, I'll leave. I'm like, we don't have to do that. We can. We don't have to. If you don't want to, we don't have to. Why might some veterans love it? Go ahead.
Because if they're going to relieve past events, they're in a safe place.
It's possible. Absolutely. There's no wrong answer here, but why might they love it?
See their friends again.
Yeah.
They get to see their friends again. Which friends?
Any and all.
Any and all.
And the ones they can't see anymore.
Specifically the ones they can't see anymore. There's a level of self-harm when we're looking at that. The only way I get to see that Marine ever again is by going into my mind and reliving the moment they died. And I'd rather see them, even if it's painful, than to not see them ever again.
Is there a danger in that it could set them back into a depression of I want to see them so I want to die, or suicidal kind of thoughts or tendencies?
There is a risk to every single therapy out there. Anytime you ever engage with a mental health therapist on any level, you're going to sign an informed consent. The purpose of informed consent is to let you know that there is a risk to all therapy. It is the professional's job to do their absolute best to mitigate the risk. It is the client's responsibility to be as honest and truthful as possible so that the therapist can do their job to the best of their abilities. So can anybody think why someone might not like EMDR? The tapping or the light?
I tried it, and it was honestly annoying.
Yeah.
Like someone tapping their foot on the floor, I'm just like, can you stop? Like, I can't do it. It's too distracting, it's annoying, I can't.
No, that's totally fair. Not the first time I'd ever heard that criticism. EMDR is just annoying. I don't want to go watch back and forth with a light constantly. That's okay, that's okay. Did it work? No. Was it bad practice for you? Yes. That's okay. It just means you try something different. Most therapists have a lot of tools in their basket or toolbox. I like a toolbox. It's more masculine. But if we don't have the right tool for you, there's a referral. Let's go back to dogs, because y'all like the dogs. Tell me about how you guys would think to utilize dogs in meditation. It's the easiest one. We're going to get the easy stuff right off the bat. In the back.
Gives you something to focus on other than your thoughts. The dogs.
Tell me how.
The dogs breathing.
Give me an exercise. Interesting. Can you smell the dog's breath at this point?
Probably.
Okay. Can smelling the dog's breath be really great to bring you back to the right here, right now?
Yes.
Boy, sometimes that'll just wake you up, won't it? Or a fart. Yes, true statement.
In bed, yes. When facing the nose.
Anybody here meditate with their dog? Yeah, a couple of you. How many of you let the dog sleep in the bed with you? Are we allowed to do that? Okay, we are? Okay, just check. So literally, I think all of you raised your hand on that one. What? Oh, your dog squish you? Fair enough. So when you lay down in bed, for those of you where the dog is laying, I guess, against your body, where's your hand? Is it on the dog?
Yeah.
What do you feel? Comfort, okay. I actually wasn't going with emotions, but I like it. Let's go with emotions. What are you feeling when your arm's around the dog? We have comfort, safe, calm,
Warm.
warm. Especially last night. Holy Lord, it was cold. For those of you in the dorms, I hear they're not insulated very well. Go ahead.
Rise and fall of their chest.
Rise and fall of their chest. Let's go to the physical. What else are you feeling?
Softness.
Softness. What else? Twitching. That little panting. Oh, the kicking. Yeah.
Heart rate.
Heart rate, absolutely. Thing beats fast, doesn't it? Well, it still beats faster than mine.
Yeah, it's different.
And a lot warmer.
Yes, a lot warmer. Like what, 101? Something like that? And what do we call that here at the University of Canine Studies? Oh, look, you guys do listen. I'm going to tell all of your teachers that you're listening.
Yes.
Well, and you'll be tickled pink.
Right? So, is that good for you? Does it work for you? Is it good practice? Of course. So there are lots of ways to do this. And this, again, not even scratching the surface. We're just going with the big ones. Within the VA, for those of you that go to work either with, for, around veterans, especially within the VA likes cognitive behavioral therapy and prolonged exposure therapy. They are starting to prescribe EMDR. And there's, most of us therapists know some form of mindfulness meditation. Okay, so let's make that point. Hold on, give me your attention real quick one more time. The point being made was, could you do all of these? No, hold on. Could you do them all? Hell yeah. You don't do them all at the same time. That's too much therapy for any one human being. I remember I did a 3-day conference on mindfulness meditation, and I found out that I have a limit to how much mindfulness I can engage in without wanting to be outwardly destructive.
Get out of my own head.
And so, too much of anything, too many Cocoa Puffs, that's a bad thing. Too much Red Bull, that's a bad thing. Too much therapy, I'm sure can be a bad thing. Because I'll tell you what, you do enough therapy with me, I'm gonna make you neurotic.